And we're going to move next to Dr. Jeffery Talbert. Dr. Talbert is a professor and researcher and the director of the Institute for Biomedical Informatics at the University of Kentucky. And Jeff's going to give us some information on a little bit more of what this is, how it works, how we protect it. So welcome, Jeff.
All right, thank you. Let's see if you can, there we go. All right, so you can go to the next slide, please. So just a little bit about a definition of what an APCD is. So APCDs collect data from all payer sources for all types of providers, and they're all linked at the individual level. This includes private insurance, self-insured companies, and public insurance. APCDs provide information about the quantity of care, the providers of that care, the cost, and the effectiveness and performance, allowing calculations of health outcomes at an individual patient level and a population level. Next slide. So there are other examples of large health data sets that are available. The Agency for Healthcare Research and Quality started the Healthcare Cost Utilization Project, sometimes called HCUP, in 1988. It's centered on data from a nationally representative set of hospitals from all across the country, and it includes inpatient and some outpatient services. The data includes all type of payers, but only reports charges, not actual paid amounts. And it does not include care provided in other settings, such as pharmacy, clinics, and other individual providers. There are also private multi-payer data sets that are available for research and for other purposes. So I have just a few listed here. Meritive Market Scan has been around for a number of years. The Symphony Health is another data set, and the Healthcare Cost Institute is another data set example. These data sets all sell their data for a fee to either pharmaceutical companies, to researchers, to health systems, to help manage and understand the provision of care in their geographic area. So researchers use Market Scan quite often. And again, it's nationally representative across the country, but it only covers usually commercially insured individuals, as well as some individuals that have Medicare Advantage plans. So they're the scope is a little bit more narrow in terms of, it's not an all payer claims database. It's kind of a selection of things. And there is that fee. Next slide. So this slide is from the APCD Council that tracks states with APCDs, or those that are interested in starting an APCD. It allows you to click on a state, and it would give you information about that state, the operation of their APCD, and if they don't have one, any legislation that's pending around that. You can see there are about 40 states that are actively engaged in starting an APCD. Some states, California and Washington, have more than one APCD in their state. They have one that's mandatory and one that's voluntary. And you'll see in recent years, even states like Texas and Florida also have joined the APCD ranks. So it really is only down to about 10 states that don't have any interest or ongoing programs to start an APCD. Next slide. So typical goals for APCDs are quite varying and large. So there's public reporting on utilization, spending, and quality. So those are some of the examples we might think of in terms of how much care was there provisioned in a particular area, how much did it cost, and then what was the quality of care provided. They also facilitate price transparency and consumer price shopping for care. They measure the quality of care. They help us understand how to improve the health of a population. So we can look at specific regions, whether they be subsets of states or entire states or groups of states. They help us reduce or control the growth of cost. We want to know how much we're paying for health and what it costs us to get there, and how the services are provided that deliver that that increase in health. It also supports health system change, such as implementation of accountable care organizations, and helps us track other alternative payment models, as well as helps us evaluate state reforms and furthering research about healthcare in the state or the state's health, or the state of health in that population. Next slide. So where do APCDs, where are they typically housed? Well, it's usually with some type of a government agency, whether it's in a Department of Health, a Department of Insurance, could be the Medicaid agency in some states, as well as it could be an independent organization or a quasi-governmental organization. Each of these models that we've seen in practice now have some strengths and weaknesses and different types of benefits. So sometimes, depending on the regulatory authority of that agency, it will allow it to get matching dollars from the federal government. Other agencies wouldn't qualify for those matching dollars. There's also a little bit difference in what the agencies tend to prioritize. So we've seen that that agencies based in insurance departments tend to prioritize quality checks on the claim financial fields, like paid amounts, versus other agencies. And those that are in departments of health focus greater attention on the diagnoses fields. So these differences kind of impact what the APCD will do and how it will function in a particular state. Next slide. So talk a little bit about data protection here. So how safe is data in an APCD? Well, all APCDs comply with multiple federal and state regulatory requirements. So there's always the Health and Information Portability and Accountability Act, or what we call HIPAA, as well as regulations from the HITECH Act, as well as regulations from the National Institute on Standards and Technology. So there's actually a whole host of these acts and regulations that any organization that stores this type of data must comply with. And the data, or these regulations, really manage how the data is stored, how users access the data, how the data is transmitted. So data is always encrypted, and sometimes we call this encrypted at rest as well as encrypted in motion. So when we send data to these types of places, it can't be intercepted across the internet. If it is, it's encrypted, much like bank information is encrypted. And when the data is stored in these organizations, the data would be encrypted at rest. All personal identifiers are removed and replaced with encrypted identifiers, not linked to any other source. So if we had a medical record number or a member ID, those things would be removed and replaced with an encrypted number that only means something to the APCD organization. So anyone that was able to get that number, they wouldn't be able to match it to anything else. Other information that can't be encrypted is usually aggregated, such as converting someone's age or to a category, blinding dates of service to plus or minus a day or two, as well as things like converting zip codes to a 3-digit zip code, so it's a larger geographic area. And then even sometimes when you've done these things, some cells that you may have in a table may have small values, like less than 10, in which case that data is usually suppressed. So instead of saying 3 people with this condition, it would just say less than 10 to, again, provide a little bit better protection for individuals so that they can't be identified from the public use files. And this last item is that data releases from APCDs also use data use agreements, usually generated from a data governance process that the APCD has in place, so that end users have guardrails on how they can use the data and what they're expected to do with the data, how they store it, and how they actually destroy it when they're done with it. And that's all I had.